Welcome to Bonnie's Beat. This is your host, Bonnie Squires. We're coming to you from Radnor Studio 21 in beautiful downtown Wayne. We like to interview people who are doing important things in the community, either in the sciences, in charities, in academia, in politics. And when you open the pages of the Inquirer and you see someone's face whom you know with like a 2-page article, you get very excited. So that's the subject of that article. Dr. Sherman Leis is in the studio with us today. Sherman, thank you so much. I don't have to call you Dr. Leis. I can call you Sherman.
Sherman's fine.
Okay. And tell our viewers the subject of the article in the Inquirer, which is really interesting.
Well, the subject was about a patient of mine and her family, who at the time was 17. I first met her when she was 16 years old.
And do you call yourself a plastic surgeon? What do you call yourself?
Well, I do plastic and reconstructive surgery. I've spent most of my career doing cosmetic or aesthetic surgery. But about 10 years ago, I got involved with the transgender world and started doing transgender surgery. And it's really taken over my practice, and people now come from all over the United States and around the world, actually, for surgery. We get nice results, and we take care of our people very nicely, very well. A lot of TLC. And we even have apartments above my office where they can stay, because most of our patients are from out of town, a few from the Delaware Valley, but many from all of the United States, Canada, and other countries. And so they either have a choice to stay at a local hotel or they can stay in one of our little apartments upstairs. They save a lot of money, and it makes it easy for me and them for me to see them once or twice a day. I just run up and down stairs in between patients and check on my patients. So about 10 years ago, although I did my first case about 37, 38 years ago.
You were a pioneer in those days.
And didn't stay involved with it because people didn't know in the trans community who I was. That first patient was sent by a local psychiatrist who wanted surgery, and we wound up doing surgery. It turned out very well. I'm still involved. I'm still in touch with that very first patient who's now living in Florida.
Was the patient a male turning female or female turning male?
It was a female to male patient, and we operated at that time. As a matter of fact, when he came to me, I said, look, I don't do the surgery. I'm not trained to do the surgery, and I'll help you find someone who does the surgery. And he said, forget it. I've looked around. There's nobody around this part of the United States that does this surgery, but you have a good reputation, and I know that if you knew the technique, that you would do a good job. I said, well, thanks for the compliment, but I said, I'll tell you what, give me a couple weeks to read. I'll scan the literature, and if I find a technique that I'm comfortable with, because I have a broad experience doing all kinds of reconstructive procedures, then we can talk about it. Well, a couple weeks later, came back, and I did find a couple of techniques that I felt comfortable that I could do and get a good result. And so we did. We admitted the patient to, at that time, Springfield Hospital. It's now part of Chester Crozier. And we did the surgery, a lot of buzz about it. The hospital was talking a lot about this because they had never had a procedure done like that. At that time, I was chief of plastic surgery out at Springfield. Turned out very well. That patient is happily married now for many years. He has sent me pictures of his children. He has 2 grown girls that are now graduating college, and
but
his wife had artificial insemination.
Yeah, I was going to say, okay.
And imagine how proud he was walking down arm in arm down the street with his wife with a
belly.
Pregnancy. And he says they have a picture of me in their bedroom, and he said he thanks me every day for the life that I've helped them have. And that kind of feeling I see over and over now, because transgender surgery really helps people have an improved quality life. So this little girl, Allie, her name's not a secret because she's been on radio and she's been on the CBS television. Last week, CBS 3 did a show on her and our practice.
But that huge spread in the Philadelphia Inquirer.
And a big thing in the Philadelphia Inquirer.
Yes.
She's a lovely, lovely girl. She was referred to me by the people at Harvard and Mass General, the chief of endocrinology at Boston Children's Hospital, and the chief of child and adolescent psychiatry at Boston's Children and Harvard and Mass General referred her to me for surgery. They send me all their cases from up there. I can't believe they send me those cases here because there's no one in Boston that does that surgery. Well, and they're happy with the results that I've gotten. A number of my patients are in that Boston area.
She went from male to female?
She went from male to female. since she was 3, 4 years old,
She always knew.
believed she was male. And that she was female, that she was male, but said
she was born a little
Mommy,
boy.
I have to go to the girls' room. I can't go to the boys' room.
Yeah, but she always felt
you
she
can't
was
cut
a
my
girl.
hair off. I'm a girl, and I can't wear those clothes. I have to wear these clothes. And she's been doing that since she was 3, which proves it. And we see that over and over, that 99.9% or more of my patients, when I ask them, how long have you felt different in your life? You knew you were different from other kids. Almost everyone says, as long as I can remember. As long as I can remember. There really is, and it's been identified now, there's a part of our brain called the bed nucleus, which is different in men and women. And transgender male to female patients, after doing CAT scans and MRIs and some autopsies, transgender male to female patients have a female bed nucleus that's responsible for gender identity and sexual choices in your life.
Now that I didn't
know. So it's
know.
something that they don't, someone just doesn't decide, oh, I want to be a girl, I want to be a boy halfway through their life. Almost every one of them knows very early that their gender of their mind is different than the gender of the body. Now, they don't understand what it is.
Yeah.
They just know something's not right. They know they want to go to the girls' room, but meanwhile the mother says, but Johnny, you have to go to the boys' room. You're a little boy. You're not a little girl. No, Mommy, and they're insistent on it. And they grow up thinking that their bodies are a mistake. Like someone born with a cleft lip and palate. That's how I think of it, as a congenital anomaly, which it is.
That's
and so
amazing.
it becomes something really overwhelming to them. And unfortunately, they go through a lot of discrimination and a lot of frustration. And a lot of people, mainly people that are not educated about these matters, are sometimes, not sometimes, frequently, very tough on these people.
Well, Sarah Palin and her husband, they think that you could counsel someone and they won't be, quote, homosexuals. What kind of garbage is that?
Forget it. That's an ignorant, uneducated point of view.
Absolutely.
That's absolutely wrong. These people grow up absolutely knowing that they're one gender, but it happens to be opposite. Tell someone a cleft lip, it's in your imagination. You just made it up.
Yeah, right.
No, because you can see it. You can't see this because it's in the brain. But to these people, it's so real. It's their life, and they're discriminated against terribly. And they're beat up and they're killed sometimes because of that.
The the parents must have been very supportive to allow someone as young as 16 to make the decision already, because that's pretty young, isn't it?
They helped this girl since she was 3 or 4 years old. She went through school, through grade school and middle school. Now she's in high school with the support of her parents and the schools. They had meetings with the school administration, and fortunately they were in an area where they understood, they were fairly educated, and they listened to new ideas, and they accepted this child and let her come to school dressed as a female. And she could use the girls' room. Very important issue for them.
What name did she change her name to?
Allie.
What was?
I don't even remember, because I just think of her as Allie. I don't know if it was John or something, or I don't even remember what it was. Because I think of her, I think of all my patients as their chosen name. Whenever they come, even if they're adults already and they come in looking fairly masculine, I say, what would you like me to call you? And they give me a female name, and this is their born name, Johnny, but their name now is Joanna. I said, Joanna, you're Joanna to me.
I remember many years ago, what was his name? There was a teacher, and after like 25 years of marriage and 2 or 3 kids, he decided that he really was a woman and underwent a sex change operation. Oh, what was the name? And if his name was Paul, he became Paula. And the wife stayed with him because she loved him, and they were a family unit. So the rules changed, but...
Interestingly, the rate of divorce in transgender people is about the same as in non-transgender people. About half of them stay married, about half of them get divorced, which is the same as the general population. It's 51 or 52% of all marriages end in divorce.
Interesting.
So it's amazing. And it proves the fact that's true in all of marriages. If your marriage is good, if people really love each other and really get along well and enjoy life together, if they have a good relationship, outside stresses will make them closer. If a relationship is not good, basically, outside stresses will tear it apart. And it'll help them split up. And that's exactly what happens in other marriages and in transgender marriages. Very interesting.
So anytime somebody uses the phrase transgender, they mean someone who has actually had surgery? Is that what transgender means?
Not at all.
Okay,
Not
well,
at all.
I'm here to learn.
Transgender means, transgenderism is a really overall umbrella, gross, very general diagnosis of all types of gender differences, gender identity differences. You can almost include, not gay, because they know what their gender is, a gay person. A lot of people think, oh, you're gay and then you become transgender or transsexual. No, not at all. Gay people, lesbians, want to keep their gender. They don't want anybody cutting off their body parts or changing their body parts. They just want to share it with someone with the same body parts.
Same sex.
That's all. But transgenderism are people with different, varied gender identities. And to my amazement, I'm still learning about it. I never cease to be amazed at the variety of human experience. But there's a large variety. Among this variety of gender identities, of people that don't want to have any gender identity, or people that want to have mixed gender identities, or double gender identities, or people that really have the body of one person and really, in their mind, they're the other gender, or a male who really believes they really are female inside in their brain, in their heart, in their emotions. And they want their relationships to be as a female if they're biologically male. So the transgender person that we're talking about, that I'm involved with surgery, is a transsexual. A transsexual person is not a transvestite. A transvestite is a person who just enjoys dressing up.
As the other
sex. Gets a little excited.
As the other sex.
If they dress up in the sex opposite their biologic gender. But a transsexual person is a transgender person who really believes in their heart and in their mind, with all their heart and all their mind and all their emotion, that they are the person that's in their mind. And this is a mistake. This was a mistake of nature. Just like you're born without a digit or with an extra digit or with a cleft lip or palate or with protruding ears or any other of a great variety of congenital anomalies. So to me, I'm used to treating congenital anomalies as a plastic surgeon. I learned to repair all these things. This is a type of congenital anomaly. It's a challenging one because it's not so easy to change major body parts from one gender to another, but it's very interesting surgery.
It must be easier to go from male to female than female to male.
It's not necessarily easier, but the results are better both cosmetically and functionally. We can create a very anatomically correct, almost identical to a natal female, and functionally correct to a natal female. A male to female can have sex, and their own family doctor, if he didn't know that they were having surgery. I saw 2 patients just this morning. Their anatomy is so good that it would be a miracle if a family doctor could tell that they ever even had surgery.
Interesting.
And many of my patients tell me the same thing.
Interesting.
And functionally, they're also very good. They can have normal sex. They can have orgasms. Every patient I know that I've done hundreds now, tells me that they've had orgasms. And sometimes it's as early as 3 weeks after surgery. Sometimes it takes up to 1.5 years. But they have a relatively normal life. Female to males, on the other hand, I can create male genitalia that look very normal and very good, sometimes better than real, because I just have that ability with my plastic surgical skills to do that. However, there's no way that we can create functional male genitalia. There's no way that we can create those specialized tissues, thousands of little blood vessels that can create a normal male erection. We just don't have that ability to do that. That's maybe in the future. I personally think it will come from stem cell transplantation.
What about electronically?
Someday. It won't even be surgery.
What about electronically? A pump or electronic thing?
Well, we don't have any electronics. There are penile implants, but I don't like to use them for the erection problem because they almost all extrude. I'd say close to 100% of them. If you imagine putting a pencil or a pen at the end of a block of butter sitting on your dining room table, the slightest push, it goes right through and out the other end. That's exactly what happens with the penile implant because it's skin and fat inside that fail us. And the slightest push if they're going to have sex, the slightest push pushes it right at the end, tears through the end,
Ouch.
and the implant comes out. So I don't put implants in, but I teach them other little tricks of external support where they can have intercourse with their wife, and they do. We can put 2 condoms on that new penis, the neophallus. They can buy in these sex shops that are even online, penile extenders or expanders. They can use other things, and they have intercourse. And sometimes they just lubricate the penis. They always have to use lubrication, and they can have intercourse that way. So they can get by. And we can create a scrotum. We take the labia apart and make a scrotum. We can put testicular implants in there. And it really looks good, but it's not functional. And of course, they can't have babies because their testicles are silicone.
There's no sperm.
So there's no sperm. But they can look very good, and they can function with a little help. But for that reason, they're not as functional as a male to female.
What would you say are the percentages of male to female surgery that you do, or female to male?
Well, every week I do 1 or 2 facial feminizations from male to female. I do 1 or 2 chest reconstructions, either put implants in for female to males or remove the breast and masculinize the chest in female to males. But I do maybe the bottom surgeries, we call them bottom surgery. The genital reassignments, that's how everybody refer to that. But the genital reassignments, we call it GRS, genital reassignment surgery, or gender reassignment surgery, or SRS, some people call it sex reassignment surgery, or some people call it gender confirmation surgery, because you're confirming their real gender. But anatomically, we should call it genital reassignment, is what it really is, because we're reassigning the gender from male to female or female to male. I would say I do 20 male to females for every female to male. A lot of the female to male trans patients don't do the bottom surgery because they know there's not going to be a normal functional result.
Yeah.
And so for that reason, that's one reason. There's another reason too. The big reason is the erection problem. The second one is the urethral extension problem. They would like to be able to urinate standing up through the penis the way a normal man can. But we can technically do that, but it's fraught with a very high incidence of complications. So I choose not to do that now because I know I'm going to be back in the operating room with them. So rather than have reoperations, more money the patient has to come up with. I don't charge for revisions, but they have to pay for the hospital. Time off from work, headaches.
Wait. Go back to you don't charge for revision.
I don't charge. If I do a revision, if someone has a complication or if they need a little touch-up procedure, and they need some kind of a revision. We take them back in 6 months or a year to make it something a little bit better, or to treat a problem, or I get problems that come from they've been operated in Thailand and come home with a bad result, or just a complication, or a surgeon in the United States, because every surgery has some problems, some percentage of problems.
There's risk.
So there's risk with every surgery. And if I do a revision for those patients to improve their situation, if they're my patient, I don't charge them anything for that. If I operated somebody,
how much does the initial surgery?
But they have to pay for the hospital.
The initial surgery. What does it cost to do the gender reassignment surgery?
In general, for both male to female and female to male, it costs about $20,000.
Does insurance cover this?
More and more it is. It hasn't up to recently, but now it is more and more. And Obamacare covers it, and Medicare now covers it. So the government is encouraging insurance companies to cover this surgery. More and more insurance companies are covering it. I can tell you that more than half, probably 60 to 70% now, of the largest companies in the United States, the Fortune 500 companies, include transgender surgery as part of their healthcare package. Some of them pay 100% of the fee. Some insurance companies and plans pay a certain percentage of the fee. They'll pay part of it. So that's a growing thing, and it's increasing all the time.
But somebody doesn't just appear on your doorstep and announce that they want a sex change operation. They must have to go through months or years of psychiatric evaluation. Do they have to come with a note from a psychiatrist saying they're allowed to have this surgery? How does it work?
Yes, in a way. Yes, you're right. People do walk in off the street sometimes. They call, make an appointment. They come in. I want this. I want that. I want facial. I want to look more feminine in my face. I want breasts, or I don't want breasts, or I want the bottom surgery. We don't just schedule them next week for surgery. No. We like to see people have letters from at least 2 mental health specialists who have been trained in gender identity issues. Now, they may need therapy, they may not need therapy. Some they just have to get checked out. I don't want to operate on someone that's psychotic and it's doing this for the wrong reasons because they broke up with their girlfriend last week. No, I want to make sure that they really are the right candidate for this, that they really deep down inside believe that they are the opposite gender as their bodies, and that they've been cleared by 2 people trained in evaluating transgender issues. We like to see them on hormones. In most cases, these are not laws, but they're recommendations. We like to see them on hormones.
For how long?
About a year or longer. The hormones for their desired gender. So we like to see them living and dressing full-time in their desired gender for at least a year before surgery. Now, these recommendations are recommendations. They're not law, and in some cases, we can bend and be flexible. I'm very flexible with these. I've operated on, for instance, executives in big corporations from New York who have a contract that's going to be up in a year from now, but meanwhile, every night, as soon as they go home, they put on their ladies' clothes and even go out with their wife, but as women. And they've been living that way, and they're waiting for their kids to get out of high school and for his contract to be up, and then he'll be absolutely 100% of the time. But his wife's on board, he was on board, she is on board, and their mental health specialists on board. And that's what I say. If you can bring me 2 letters from your therapists that you're a good candidate for this and you're otherwise mentally stable, and that they recommend this surgery for you, it's okay, it's fine with me. And I don't care if they haven't been living for a year full-time in their desired gender. That's okay. In most cases, unless they have a medical reason not to, it helps them feminize if they're going to be, or masculinize if they're going to be on hormones for several months or a year or longer. Many times I have patients that come to me, they've already been living as a female or male, opposite their natal gender, for some years and been on hormones for years. Well, then I don't feel that strongly about needing these 2 letters and making them jump through any hoops. And they take offense at that sometimes when we tell them, they look at it as, why should somebody else tell me what I know already in my heart, in my mind? Well, I don't do it as a gatekeeper. I do it as just a safety factor. I want them to be happy and healthy and not regret that they did it 6 months later. And luckily, that incidence of regret is very rare. It's about 1%.
It's not reversible.
Not very easily. We can never bring them back to where they were, although I've had to reverse a couple cases.
Really?
Yeah, not my patients, but I've had to reverse a couple cases that came elsewhere that they feel they've just made a mistake. They were pushed into it by their partner or something like that. They were talked into it by this person or that person. And then when they broke up with that partner, they realized, hey, what did I do? This is not for me. I was trying to make that person happy. I was so in love. I was crazy in love with that person that I've lived with for 5 years, and they wanted me to do that. They wanted me to be a real girl. And when they broke up, they realized that was a really big mistake, and then they came and they wanted to reverse it. And so once you reverse it, it's never the same as they were originally. We can't do that. So it's almost a one-way street.
But it's major surgery, I would assume.
It's absolutely major surgery. It's very, very major and very complex surgery.
Too.
No, I wouldn't say very painful. We have very good medicines today. We almost don't use narcotics anymore, even after surgery. It's less painful than a gallbladder operation or a hemorrhoid operation, I would say, today.
I want to make sure that we put your website and your phone number up on the screen. The website is, what is it?
Dr. Sherman Leis. No, the website.
www.drshermanleis.com.
No, it's Dr. Sherman Leis at drshermanleis.com. It should be, my name should be repeated twice.
No, that's your email.
That's the email.
We're talking about the website.
Oh, okay.
The website is
no. The website, our transgender website is thetransgendercenter.com.
Oh,
that's
all
the
right.
website.
Thetransgendercenter.com.
Right.
Okay.
And that's a very comprehensive website with the history of transgender surgery, all the different types of surgery that we do, and a lot of before and after photographs of transgender patients.
Thetransgendercenter.com.
Right.
And a phone number for your office?
The office is 610.
We put that up on the screen?
It's
Here we go.
610-667-1888.
Okay, 610-667-1888. 1888.
Right.
Now, getting back to the young lady who came to you at 16, and now she's a young lady. She was a boy living as a girl since like the age of 3.
3, 4 years old, right?
And had she been under a psychiatrist's care?
Yeah, she was under the head of psychiatry at Boston Children's Hospital and Mass General and Harvard.
Okay.
So they were referred. She was referred by some very high-ranking people.
Oh, I would
They're really
say so.
authorities in their field in the country and in the world.
How long ago did you do her sex reassignment?
About 2 months ago.
Okay, and you
About 2
kept
months
tabs.
ago.
You keep tabs on her?
Oh yes, I see her regularly for post-op exams. As a matter of fact, I was at a surgery meeting in Boston 2 weeks ago, and she came over because they live close to Boston. She came over to my hotel, and I had a meeting with her there and examined her. She came with her dad, and she's doing just great. She's an absolutely adorable teenage girl. She's just a lovely girl.
And she's accepted by a group of girlfriends?
Everyone who knows her.
Isn't
Everyone
that
who knows
wonderful?
her. She's been accepted for years already. They only know her. Her friends and family only know her now as a girl. As a lovely, lovely girl.
It's interesting because there was a television movie with Tom Wilkinson playing the long-standing husband, and he decided his whole life felt as if he should have been a woman. And it was a very complex plot, whatever, and in the end, his family accepted that, and he had the sex reassignment operation. But you could see it was a very painful decision for someone who had lived most of his life as a man and had fathered some children, and felt as if he were inflicting shame and pain on his wife, on his kids, because I would say that most of society is not very accepting. They're not accepting of gay people. They're certainly not accepting of transgender people. And the last on the list would be transsexuals, because especially men gasp when they think, oh my God, he cut it off. How could he do that? You know. So what kind of educational efforts do you applaud for getting people to realize that somebody's suffering, they should be relieved of their suffering?
Exactly what we're doing now.
All right.
Media exposure, newspaper, magazine, television, cable, discussions on this subject, interviews with people who are transgender, who are going through it or who have gone through it already. And then the public realizes they're just normal people, that they're born with a problem that they want to take care of and live a happy life. Everybody wants to live a happy life. Transsexual people don't choose to go through this. They don't wish all these troubles on their life.
I'm sure.
It's a lot of trouble. And the same with gay people. They don't make a conscious decision one day when they wake up because they broke up with someone that they're going to change their gender or change their sexual attitudes. That's the way they are. And they're just normal people except for that, but then that's normal. That's considered now a variant of normal human endeavor, human life.
At med school, do med schools now, do they teach people how to do
Well, now we do, because I teach at PCOM and I talk about it a little
Philadelphia
bit.
College of Osteopathic Medicine.
Right.
Okay.
But other medicals too. I've been asked to speak at other medical schools. I have urologist friends at other medical schools who ask me to give them information so they can present, because they've been asked to talk about it. They don't know what to talk about. So I've given them information and material and some slides so that they can teach the medical students what's going on. So today, more than before, when I was in medical school, I never heard of it. I had no idea what transgender business was transsexual or transvestite. I didn't know anything about that, and certainly no one spoke about it. And I had plenty of psychiatry classes, but no one mentioned that at all. And certainly the surgeons didn't, because no one was doing it.
Well, if you want more information and you want to reach Dr. Sherman Leis, Leis, you can Google www.thetransgendercenter.com. Again, www.thetransgender. We're putting the wrong, sorry, that's not the right address. The right address is what I'm saying. It's www.thetransgendercenter.com.
That's right.
And that will tell you anything you need to know about this very interesting leap of faith, shall we say. And Dr. Leis, thank you so much for being our guest. And we'll see everybody next week.